Not a problem. Happy days?
All good, thank you.
ABC's good? Brilliant.
I know. Look at me, I wish they came extra.
Are you going out live yet?
Yes. Via Sydney.
Via Sydney, okay. There you go.
Okay.
Yeah, it's only 3 hours.
I can see that there's someone in our online.
Yeah. Oh, sweet. Let me leave this here.
What's that? I started something. Either, so it has to go.
All right, good morning, everyone. All right, well, in good news, overnight we've had 0 new cases, so we only have 5 active cases in Queensland at the moment. And over the past 24 hours, we've had 5,085 tests, which is wonderful. And of course, if you are feeling sick, make sure you stay home and get tested. So, well, today is a very exciting day because some of the supply of the Pfizer vaccine has just landed into Brisbane as we speak. So one plane has touched down at 10:30 and in Brisbane, and another plane will be touching down in Cairns at 11. So this means that we have the supply, so the vaccine rollout against COVID can begin in earnest tomorrow at 8:30 on the Gold Coast. So the Health Minister, Minister Darth, and the Chief Health Officer will be down at the Gold Coast tomorrow to see how that progress is going. But that's exciting news for Queensland. This has come at exactly the right time, and of course we hope that everybody across our state will take up the call to get vaccinated. And when it's the right time, of course, myself, the Health Minister and Dr Young will also get our vaccines, and as we said, that will be in phase 1B. The priority at the moment is to ensure that we get the vaccine out to where it is needed most, and that is our frontline hotel quarantine workers, and for the Commonwealth, of course, it's aged care workers and aged care residents. So we hope to vaccinate more than 1,000 Queenslanders in the first week of this rollout, and over the next 4 to 6 weeks, we hope that there will be 125,000 people in total will be vaccinated under Category 1A. Now, I do want to stress, I was down at the local bakery this morning, and I think this is the question on everyone's lips. It's, when am I going to get vaccinated? Well, it'll be a progressive rollout, and we'll be keeping you updated every single step of the way. So there is no need to panic. We don't have any community transmission in Queensland. The rollout of the vaccine will be happening from now until the end of October, and we urge, when it is your turn to get vaccinated, you'll be told when it's your turn. When it's your turn, please go and do that. We get vaccinated for a whole range of diseases. We've been doing that all of our life, and immunisation is really important. And as I said, if Dr. Young says it's okay to get vaccinated, absolutely I will get vaccinated, and we really need all Queenslanders to do this when it is their turn. So look, this is an issue that everyone is talking about, and of course it is dependent on the supply of the vaccine coming from the Commonwealth. So the Commonwealth is responsible for vaccinating 60% of the Queensland population, and the Queensland government is responsible for vaccinating 40%. But we want to work together. This is the time where the shared responsibility must be worked in tandem, and we're going to work very closely. As I said last week, our head of the Department of Health, Dr. John Wakefield, went down to Canberra to observe the National Coordination Centre, and we also have a senior official down there in Canberra that's also working out of the National Coordination Centre, so we can have confidence that the rollout is going to plan. So an exciting day today. It has the vaccine has landed in Queensland, and tomorrow the first Queenslanders will get vaccinated on the Gold Coast, commencing at 8:30. So I'll hand over to Dr. Young and then Yvette, and then we're happy to answer some questions. Thanks, Dr. Young.
Thank you very much. This is indeed an extremely exciting day. This is fantastic. This is what I've been hoping for right from day one of this pandemic, and what a response we've had from the world scientists to have developed a vaccine that is so safe and so effective so quickly. So I certainly will be putting my arm out for the first vaccine I'm offered, and it's going to be in 1B after we've had those absolutely crucial hotel quarantine workers vaccinated, and those frontline healthcare workers who are treating people who have COVID-19. Once they're all done, I'll be there getting vaccinated, with whichever vaccine is offered to me. Both of them are fantastic vaccines. The Pfizer vaccine or the AstraZeneca vaccine, they're great. Then we'll be rolling out through the rest of the state, and everyone who is 18 years of age or over will be offered a vaccine in Queensland, and I hope every single person takes up that offer. It is so important because we're not quite sure yet what having the vaccine means in terms of being able to spread the virus to someone else. So the answer to that is just everyone get vaccinated, because then you protect yourself. It's clear this vaccine will stop you getting severe disease and dying. And that is what we want from a vaccine. That is the first thing we want from a vaccine. The second is we want to stop people getting it so they can spread to other people. We know that reduces significantly, and that risk is significantly reduced. We've seen that in the results in the UK and in Israel, where they're starting to get large percentages of their population vaccinated. And they're seeing the number of cases rapidly decline. Across the world, since this vaccine's been rolled out, we've started to see cases significantly decline. So that is really, really good news, but we don't have that full evidence. So the most important thing is that when you get offered a vaccine, take it. It's really important. You then need a second vaccine 21 days later if it's the Pfizer vaccine, or 12 weeks later if it's the AstraZeneca vaccine, because the evidence shows that's the best interval to get the best protection. You can have the AstraZeneca one earlier than the 12 weeks if there's a real need to. For instance, if you're about to undergo some medical treatment that means that you need to have it earlier, or if you're about to, you have to go overseas and be exposed and you don't know if you can get the vaccine over there. But for the vast, vast majority of people, 12 weeks is for the second one. And just remember, you start getting protection right from the word go. You don't get full protection for a while, but you start getting protection, as we've seen in the UK. So yes, today is an absolutely exciting day. I certainly will be celebrating in my house tonight very much. This is fantastic. And tomorrow we'll start the rollout at the Gold Coast, and I've been given the opportunity to go down there and see it, and I'll be congratulating them. They had the first cases in Queensland, and now they're going to have the first rollout of the vaccine, which is excellent.
Well, just over 12 months ago, our lives changed. Globally, we saw a global health pandemic being declared. We were told to stay at home. We were told not to have visitors. We started homeschooling our children. Businesses had to close their doors. But yet, 12 months on, we are now here celebrating the arrival of a vaccine that can help us get back to what we've enjoyed in this state and in this country, which is out and about in our communities, have our economy fully open, and just looking at the remarkable outcomes in just 12 months from the physicians, the researchers, the experts around the world to get us to this point. The vaccine has arrived here in Brisbane. It will now be transported to the PA and be transported also to the Gold Coast University Hospital, and shortly the flight will land in Cairns and deliver those vaccines out to the Cairns Hospital as well, so that tomorrow morning we can start delivering on the Gold Coast those first vaccinations. The schedule still remains the same, that Wednesday we'll see the PA come online, and on Friday we'll see Cairns, and the following week we'll see the remaining 3 hubs commence vaccinations as well. I want to thank the amazing health staff who have worked tirelessly to get these vaccination centres up and running in our hospitals and ready to start the vaccinations in the next few days. I know they're excited to be part of history. The smiles on the faces of the team I met last week on the Gold Coast, they are just so proud and humbled to be part of this most historic occasion, to be actually delivering this vaccine. I look forward to being able to get the vaccine when it's appropriate, but as the Premier and Chief Health Officer has said, this week, the next couple of weeks, is all about our priority group, getting it to those who are working on the front line, most at risk of contracting COVID because of the people they're working with, particularly arriving from overseas and around our hotel quarantine. Thank you to all the Queenslanders who are eagerly awaiting this vaccination. It will arrive. We will make sure that you get your opportunity, but we do need people to be patient. We are in a very fortunate position in this state and in this country. We don't have broad spread transmission in our community like we see around the world. We haven't had to fast track this vaccination. It's gone through a proper process through the Therapeutic Goods Administration. It's received its approvals, and now we can start delivering it in a staged, sensible way to make sure that everyone gets the opportunity to get this vaccine. Of course, it's contingent on these vaccines arriving here in the numbers that we need in Australia and in Queensland. So we'll continue to work with the Commonwealth. We can't vaccine if the vaccine's not here. We can't vaccinate. So we'll work very closely with the Commonwealth to find out when they will be arriving and in what numbers, so we can start making sure the public are aware every step of the way when they'll be able to come out. But we will let you know. We will let Queenslanders know when you can come out and get vaccinated. And when we do make that call, we hope you come and we hope you get vaccinated and do your part to make sure that we can all stay safe.
Thanks, Yvette. We're happy to take some questions on this first. Absolutely, it's still alive, and our agencies are continuing to liaise and work with the federal government on this very important issue.
How will we get notified that we'll get our vaccine? Will we get a text message like others?
I might get Dr. Young to talk about the logistics, but can I just reiterate, everyone please be patient. This is going to take several months, and we'll be keeping you updated, every single week about the progress of the rollout. and when the next phase is happening. So I don't think the public need to worry, but I know that honestly this is the number one question everyone is asking me: when am I getting the vaccine? So we've got to protect our most vulnerable first. So it's the hotel quarantine staff, it's our aged care and our aged care workers, and then we'll be rolling it out to the population in according to age groups, starting with 80 plus and 70 plus. So I'll hand over to Dr. Young.
Thank you very much. Yes, that's a really important question. So I'm going to go through some details here, and people can of course go on our website to get these details, or can go on the Commonwealth website. But phase 1A, which starts tomorrow at the Gold Coast and then goes to the other 5 hubs, it will cover 125,000 Queenslanders. 37,000 of them are quarantine and border workers and are direct frontline healthcare workers who are managing cases of COVID. So we have 5 cases of COVID in the state to date being managed. So it's the people who are managing those cases, and in the ICUs, not that we've had a case in ICU for quite some time, which is fantastic, and the COVID wards. Plus the Commonwealth, so we'll do those 37,000 through our 6 hubs. The Commonwealth will be doing their area, which is aged care and disability staff and residents, a total of 88,000. They'll be managing those. So they're starting this week with 41 aged care facilities, and they'll rapidly escalate and do those 88,000. So that's phase 1A, which we are dependent, of course, on getting the doses of vaccine. So we'll just have to work that through. So hopefully we'll get that done in the first 4 to 6 weeks. And then we can move on to phase 1B. Now, phase 1B is 1 million Queenslanders. So that's everyone who's aged 70 years and over, and most of those people will be able to go to their normal GP. So that's we think that is the most appropriate way to get people vaccinated, that they go and see their own GP and get vaccinated. So there'll be that. There also will be those respiratory clinics that the Commonwealth set up to test people. Now some of those will pivot to become vaccine clinics, and others will be set up, so there'll be those as well. Included in that 1 million are all other healthcare workers, public and private. So we'll work with them, but a lot of them will be vaccinated in their own workplace. They'll be able to vaccinate there. Then any of our First Nations people in Queensland aged over 55 are included in this group. Younger adults who have severe underlying disease or disability, they're in this group. Then our critical and high-risk workers, so police, fire, emergency services, defence, and then one additional group which hasn't impacted us in Queensland at any point due to a tremendous amount of work by the Department of Agriculture and Fisheries, is the meat processing workers. Because if you remember, there were a lot of outbreaks in meat processing areas because of the environment they're in. It's conducive to the virus, so they're included in that 1 million, because we know if it were to get into that environment, it's high risk and spreads rapidly, as we've seen in other states. So that's the second, that's 1B. Then really the majority of people will be after that. So there will be in phase 2A, 1.3 million Queenslanders, and that's Queenslanders aged 50 years and over, First Nations people aged 18 years and over, and then any people who haven't been picked up in that 1A, 1B, who are critical high-risk workers. So if people have been on leave or are not able to be vaccinated, we'll of course continue to pick up those people. But that's another 1.3 million Queenslanders. And when I say Queenslander, at this point in time, anyone who's on the soil of Queensland is an honorary Queenslander. They'll get vaccinated. So any refugees, anyone without Medicare cards, anyone. So anyone here in Queensland will be offered the chance to be vaccinated at no cost. Then we go to phase 2B, which is another 1.5 million Queenslanders, and that's the remainder of anyone who's 18 years of over, who hasn't been caught up in any of the earlier phases. Then We need to wait and see the evidence from overseas. The TGA needs to look at it, because that's when we'll start looking at whether or not we should be vaccinating kids, so anyone under the age of 18, and whether it's all kids or some kids or how we do. But we're really, really good at that in Queensland. We get more than 95% of our kids vaccinated for all of their childhood vaccines. We've got a great schools program, so we're not worried. We can easily put that in there if that is the decision that's made. So that won't happen till late in the year. The plan would be to try and get all of those other people, so those 4 million Queenslanders, vaccinated, at least their first dose of the AstraZeneca by the end of October, given there's that 12-week gap that we think is best between your first and the second dose. It just might push some of those second vaccines out past the end of October. But we would hope that every single adult Queenslander has been vaccinated by the end of October, at least with their first dose. Yeah, so we'll do a lot of messaging through our website, and if Facebook's available to us through Facebook, we'll really get those messages out when it's time for people to just start booking with their GP or to go to a pharmacy. So we do a really good job every single year. We vaccinate close to 2 million or possibly more Queenslanders against flu each year very, very successfully. So I'm not concerned. Once we've done those priority groups of 1A, 1B, it will be really easy to get the vaccine rolled out through pharmacies, through GPs, through some of our mass vaccination clinics, the Commonwealth ones and the state ones, and we'll let people know. People will know, I can assure you. There'll be no one left in any doubt at all that it's their time to come forward and get vaccinated.
How does this change the risk of having to call measures like snap lockdowns over the period of the rollout, and how do you see that beyond October?
Massively change, of course it will. So we're going to have another way of mitigating the risk if we do have any outbreaks, which is our traditional way. Vaccine is how we would normally manage outbreaks. You don't see us close down the state because we've got a case of measles, and measles is a terrible disease. But we manage it through vaccination normally, because we have over 95% of our kids vaccinated. But then when we have an outbreak, we go in and check and vaccinate again, or we use immunoglobulin. We do other things. So this is another way now that we'll have. It won't be day one. I mean, it won't change anything tomorrow morning. But of course, as we've got more people vaccinated, it will change how we manage things. Remembering, of course, that our main purpose with Phase A is to stop it getting out of our hotels, to vaccinate those quarantine workers, because they have done the most brilliant job. We've had one breach here in Queensland, and everyone regrets that one breach. Of course we do. But it's the virus. The virus has become more infectious. We know it's a risk in the air, in those corridors, so it'll be just so good to have those people vaccinated.
Dr. there was an AMU study this week that showed 1 in 5 people are still hesitant on getting the vaccine. Are you confident with the federal government's education campaign, the reach of it, and your thoughts about it?
Very, very confident. So it's an excellent campaign, and we're leveraging off it, and we're doing our own campaign here in Queensland. And look, of course people are going to be hesitant. It's a brand new vaccine, but that's our job, to explain to them that it's a very, very safe vaccine. I think there are people concerned that it's happened so quickly, but they shouldn't be concerned, because each component of testing and making sure that vaccine is safe has been done as it is traditionally done. All that's happened is that governments around the world have poured money in. If governments were able to pour money in to other vaccines, they would happen as quickly. But there isn't the same need. So normally what happens is you do the first phase of the trial, it works, so then you go and ask for money to do the next phase, because a lot of first phases don't work. So you wouldn't be asking for money right up front, because there's a good chance your vaccine won't work. So you go through it. But this time round, the whole world got behind all the scientists and funded it, so that the scientists could actually keep going. They didn't just have to stop and say, we now need some money. And sometimes it took a long time to get that money for very, very understandable reasons. That didn't happen. But every single requirement was met and done thoroughly. And the TGA used the same process they use for any other vaccine. They didn't shortcut it, they didn't do anything different, they went through. So it's a perfectly safe vaccine, and it's also extremely effective. So we do have other vaccines that we know have variable effectiveness, such as the flu vaccine. This is not one of them. This is a really effective vaccine. It stops people dying.
Do you know how many doses have actually touched down?
We're getting 10,000 doses this week. So I think that's probably what's touched down, but I don't know definitively.
Have you had information of how regular those arrivals will be from the Commonwealth?
Yes, we'll get them each week going forward. So we've been given a clear process for the first 4 weeks. After that, it's a bit less clear. We expect it to ramp up, and we also expect to start seeing some AstraZeneca coming into the mix. But we haven't got those details yet, but we've absolutely got enough to go ahead for the next 4 weeks with our plan.
Do you have a view on what proportion of the population you're comfortable before we have herd immunity?
If you could ask that question slightly differently, what percentage of the population would I like to see vaccinated? 100% of adults who are 18 years or over. That's what I'd like to see, and that's my aim.
Earlier this week you said you wouldn't be receiving the vaccine first up because you didn't want to take it.
Yes.
What do you make of the Prime Minister receiving?
That's the matter for him, but I understand as the Prime Minister of the country, he might want to set the example for the whole country. So, look, that's entirely a matter for him. But personally, I'm taking the advice of Dr Young, and we'll do that. We'll take our vaccine in 1B.
Have you had any more?
Increased security around hospitals, especially for the delivery of the vaccine?
Not to my understanding. I think it's just normal.
Or are you concerned
Yeah.
about people turning up tomorrow wanting a vaccination?
No, so please, everyone, do not turn up anywhere tomorrow for the vaccine, okay? So it's really important that, like I said, it's our most at risk. We want to get vaccinated first, and the majority of the population will start seeing the rollout around middle of the year.
And once we get most people vaccinated by the end of October, do you hope that Queensland will be involved in that?
Oh, look, that would of course be everyone's desire that that would happen, but that's going to be, if it's anything to do with international neighbours, it would depend on those countries being vaccinated and the Commonwealth and the AHPPC being confident that that travel could occur.
How confident are you in the ability of the Commonwealth to secure that supply beyond the next month?
Well, like I said, everything is dependent on the Commonwealth producing the supply, guaranteeing supply. So we've got our plans in place. We're ready to go. Let's do it.
Just on another note, Queensland set to enter a major housing shortage over the next 2 years with declines we haven't seen since 2014. Are you worried about that?
What we are seeing is a lot of people moving to our state and a lot of property being snapped up. I think everyone's been reading those reports and hearing those stories. I've also had some people telling me that they need to release more land for development. So this is something that that the Deputy Premier is having a close look at.
Have you given any more thought around?
One at a time. Sorry,
Have you given
Jess.
any more thought around further encouraging people to take it if that's necessary as the rollout goes on, like requiring it to enter particular places like pubs and clubs or whatever, like requiring people to be vaccinated?
I think the number one issue here is to get vaccinated. We want the population to get vaccinated, and the more people that do that, the safer we will be as a state and the safer we will be as a country.
Is that option open to you though? To look at that?
We haven't looked at that.
What sort of assumptions are being made for the budget and so on about interstate border travel being vaccinated?
Well, they're always constantly reviewing their plans, but look, it's just going to depend. It's depending on now the rollout, the supply, and getting people vaccinated.
When do you expect to see numbers return back to pre-pandemic levels?
In relation to what?
Domestic travel.
Sorry,
Domestic travel.
I don't have a crystal ball. Let's get people vaccinated.
Has your government put any further consideration towards shield laws, and do you think the CCC should be able to compel journalists to avoid those sources?
Well, look, my understanding is that there's a current court case at the moment, so I'm not going to comment on that, but I will say that the government made a commitment that we would introduce those laws, and the Attorney-General made comment on Friday that it is, of course, a priority for this government.
Is that the case with defamation reforms as well, flagged with collapse?
No, that's a coag issue, so that's being dealt with separately.
Coming into line with that.
Well, those conversations happen with the Attorney Generals. Yep.
Just one other question
Yep.
in regards to housing. Your position said we need to bring forward infrastructure to protect our lifestyle.
Well, we have a great lifestyle because we've been able to manage the health response, and our economy's been able to. In other countries, there is no construction. People are basically at home. You only have to look at what's happening around the world to see how the world's reacting to COVID. So, of course, we recognise that housing is going to be a big issue. We've got a housing infrastructure budget, and of course it's very important that there is housing affordability out there for people to be able to enter that market. It's very important.
Any thoughts on the federal government's handling of serial rape allegations against the former staff?
What happened in Canberra is devastating beyond words, and there needs to be a full investigation and full support offered to the woman so she can put her complaints forward. And I understand that the federal police are looking at that, so I can't really comment, but I think it was badly handled, very badly handled, such a serious sexual assault. Yep, then that'll be the last one. Yep.
We're not sure. We don't really have that data. Well, it'll come out of the UK and Israel, places that are really ramping up their immunisation strategy and getting large numbers immunised. It definitely will reduce the viral load. So even if you still catch it, you'll have less virus, so therefore you're less likely to pass it on. We have that evidence that shows that it's the amount of virus that you've got that impacts whether or not you become a super spreader. So it's immediately going to reduce those super spreading events that we've seen where one person has spread to 40 people. So that immediately will reduce. So that's excellent. But in terms of whether it completely stops transmission, we just have to wait for the data. But at this point in time, we know it stops someone who gets exposed from getting severe illness and dying. And that's what we want a vaccine to do initially.
Thank you.
Very nice.